What's good, guys? I'm Corley with Functional Patterns. I'm back to talk to you about lower adductors. So lower adductors are in the quadricep region and on the medial end of those things. So medial is the interior, adduction means to go towards the center, abduction goes away from the center. As you can imagine, there's a balance between abduction and adduction, okay? Joint centration. So this impacts the pelvis and the knees. Basically, the short version is that you want to have everything centered and balanced. So we're going to tune into the lower adductors and get these guys restored to their proper length tension, especially you individuals with that external rotation. So you already know that the gluteus medius is in dysfunction, and also then the lower adductor is unfortunately in dysfunction because it's externally rotated, and then all of a sudden that creates issues. So just know that it's fixable and it's going to be especially sensitive for you. So it's all good. I'm going to demonstrate 3 different techniques on how to release the lower adductor. The first technique that I will use is the elbow. So not quite the ball of the elbow, the pointy part, but there's this flat part on the forearm, and we call that the elbow. Don't tell anyone, it's just really the forearm. So anyhow, we're going to do that. And then I will grab the lacrosse ball and then the PVC pipe. Alright, so let's start with the elbow. Coming down to the ground, I'm going to put this leg at a 90-degree angle. I'm going to put the arch of this foot in the knee of this. Have a 90-degree angle. 90-degree angle, guess what? 90-degree angle. I'm going to take a second to find my lower adductor. Voila, there it is. I can feel it. I'm going to employ my latissimus dorsi and my obliques in a spinal rotation so that I can kind of lock this in and have consistent pressure from the middle of my leg to the knee, which is what we're going to be releasing. And here we go. So first step is to find breath and inhale. Exhale, apply this pressure. So I'm going to go through and inhale, exhale, I'm slowly moving my forearm across the muscle towards the knee. With each breath, I'm employing visualization technique. So in my head, I'm picturing the lower adductor and what it looks like when I start and where I want it to go, which is more relaxed and longer. And inhale, exhale. Okay, move to the other side. So, 90-degree angle. Arch your foot into the knee. 90-degree angle. 90-degree angle. And guess what? You got it. So I've got the elbow into my adductor. I'm tuning into my breath. I'm rotating my weight into this muscle. And I'm working my way from the middle of my quadricep area to the knee. And here we go. Now, you know it takes a minute or two for each area of the muscle to relax and release. I'm showing you 3 different techniques, so I'm going to go through this slightly more rapidly. When you do it on your own, choose one technique each time and really take your time to get that release so that we can fully restore length tension to this muscle. Alright, so that's the elbow technique. Let's get into the lacrosse ball. I'm going to start with my opposite leg out in a straight line. This one at a 90-degree angle. And putting the lacrosse ball underneath. Okay, so now I'm going to turn my torso so that my hips are square to the ground, almost as if I'm making love to the ground. And now, inhaling and exhaling. Inhale. Exhale. I am going to use my ankle as a way to rotate my my body so that I can get this spot and also move the arm. So here we go. And square off. Inhale. Renew that commitment. Ensure that your hips are towards the ground. And rotate the ball towards the knee. Inhale. And exhale. Rotate. So I'm going to stick with this for a second. I can feel a little bit of a referral pain going into the knee. So it's an indication to really take a minute, relax, recommit, and inhale. Okay, let go. I'm going to finish up. I'm going all the way to the knee. And just make sure that I got everything in this area. It's feeling really good. Let's do the other side. Start up this way. And how's that? You like that? Square off. And let's go here. And plant that ankle. Use it. Square these hips off even more. And ready, set. Inhale. Exhale. Exhale. Rotate. Readjust. And inhale. Just really feel your way through it. I mean, this is about you. I've said it before, but it truly is. So feel around. Does it feel good? Alright, then keep going. Go to where you find a sensitive spot. So I just found one. Gonna check. Feel like I'm squared off. And I'm relaxing. Recommitting to my breath. I can feel my central nervous system kicking in, so it's a particularly good spot. And I'm going to honor that spot. I can feel twitching going literally all the way to the knee. That's great. That means that we're getting a spot and eliminating dysfunction, compensation, and discomfort. So here we go. Inhale. Nice. There it goes. Okay. It's that easy. Inhale. And wow. Okay. So that's the lacrosse ball. Let's check this guy out. It's much the same. Two, position PVC pipe. That leg's at a 90-degree angle. Here I'm going to go elbow to elbow. Again, square the hips off. We love the earth. Okay? So that's how you really get into this. You'll feel it when you're down here doing the same thing. It's pretty self-explanatory. But inhale and roll. Inhale. Exhale, and I'm moving that pipe towards the knee. Found a little spot. I'm adjusting this leg. I'm going to square everything off. I'm going to just sit on the pipe, sit on the spot, chill out for a sec, renew that commitment. We know that the dysfunction that we eliminate from the body today makes getting through tomorrow that much easier. So the time is now. And inhale. Exhale. Readjust. And take it all the way to the knee. Okay. Last side. Here we go. Let's get it. And let's do the elbow business. I like that. And here we go. Okay. Square off. And inhale. Exhale. Inhale. Essentially, I've created a rhythm here where I'm inhaling, I'm exhaling, then I roll the pipe, inhale, exhale, roll, and the same. The reality is that when you hit a spot, you gotta stay there for a few breaths. Like, it's not time to go until it's time to go, and your body will tell you when it's time to go. So don't be in a hurry. This is a commitment to you, to your body, to your health, to restoring lung tension, to your posture. So remember that. and inhale. Alright, so 3 release techniques for the lower adductors. We've got the elbow, right in the elbow. Our favorite lacrosse ball, definitely use a tennis ball if that feels better for you. And then the PVC pipe. So we are restoring length, tension, we are restoring our posture, we are eliminating compensation, dysfunction, and discomfort. I'm Drew Corley with Functional Patterns. Remember, live intentionally, not habitually. Like this video, subscribe to the channel for more information. More than anything, take care of yourself. Thank you.